bloody ridiculous. Kim Kardashian gets a so-called vampire facial. Does getting this ugly really work to preserve beauty? Plastic surgeon to the stars, Dr. Vladimir Grigoryants is right here tonight to tell us if Kim K's bloody facial really works. But which newsmaker will be number one? Showbiz Tonight continues right now. Well, let's move now from a Trump shocker to a Kardashian stunner. Number two on the Showbiz countdown of the day's biggest newsmakers, Kim Kardashian and her cringeworthy, bloody vampire facial. Did you see what was happening in social media? It was still on fire today over what we saw Kim do on Sunday night on Kourtney and Kim Take Miami. She got a facial using her own blood. You got to see this to believe it. Let's watch it.
Okay, we're going to start. Beautiful. More bloody. A little bit more PRP. I know this is a very sensitive area.
That hurts right
Around the bone.
Ow, that hurts so badly. Ow.
One more line and we're done. All right. That's it. You're set.
Oh my God, I will never get a facelift if it feels like that.
So this was the hard part, this pain, or does it get like the pain kick?
No, there's no pain now.
Oh, this is it?
Yeah.
Oh, okay.
We're all good.
All good, my butt. Does a vampire facial really work? With me tonight from Hollywood, Dr. Vladimir Grigoryants, who is a plastic surgeon to the stars. Doctor, I appreciate you being here. And to be clear, you were not the doctor performing that vampire facial in the video, but you are familiar with this procedure. You look at this thing, and quite frankly, it makes me a little sick when I see that. It looks wild, crazy, and painful. But first of all, does it actually work?
Hi, Jay. Well, thanks for having me on the show. To make a long story short, there is no evidence that a vampire facelift or vampire facial produces long-term results. In this procedure, patient's own blood is used to inject in the soft tissues. And supposedly, the growth factors that are present in the blood, as well as the cells that can produce those growth factors, will produce enough effect so that there's going to be more collagen, and therefore the wrinkles will appear less noticeable. However, to date, there is no clinical evidence that this treatment works.
And when you look at all the pain that Kim apparently was going through there, she's squirming in her chair. It's a literally a bloody mess all over her face. Can you describe for us how it actually feels? Is it more like acupuncture, or is it kind of like scraping?
Well, the instrument that they're using has needles that are going in and out of the skin at a high frequency. So what she's experiencing is this poking pain, but I presume they must have used some kind of numbing cream initially, which will help but does not relieve the discomfort completely. I'm not sure how much with this treatment they'll actually inject Kim's own blood. I can't imagine there'll be a lot of blood introduced with this technique. So most of what she's going to get is just piercing of her skin, and I can't imagine that there's going to be a significant improvement, to tell the truth.
It's like, who wants to do that? Well, let me bring in Jenny Hutt. Maybe she does. She's with me in New York. She's the host of the Sirius XM show, Just Jenny. You're interfering with your own plug here, Jenny. You must be feeling very strongly that you don't want to do this. Put the picture up again, Charles, if you would. Kim tweeted this out to her 17 million followers, blood still on her face. So obviously, you find it shocking. You're not heading to the doctor's office after the show.
Well, but I have more issues with it. She's pregnant. I wouldn't put myself through something like this where I'd have pain. I feel like it could distress the baby. Like, when I was pregnant, I stayed home and gestated. I didn't really care what was going to happen to my skin at that point, really.
So, doctor, do you see this as another over-the-top celebrity fad, or do you think this will stick around? I mean, you're saying yourself there are no proven results here.
Well, to tell the truth, I don't see how this treatment will become widely used by plastic surgeons and other practitioners for lack of clinical evidence. Secondly, in my practice, I do a lot of rhinoplasties, and you can imagine many patients will develop significant bruising. With bruising, your soft tissue is saturated with blood. So if you think blood works that well to rejuvenate your face, then all of my rhinoplasty patients should have less wrinkles in their face. But that's not the case.
And third of all, it's nauseating.
Well, yeah, just to clarify, Kim was not pregnant when she got that facial. And that's what $1,500 will get you. We'll leave it there. Dr. Vladimir Grigoryants, thank you so much. Jenny Hutt, thank you as well.
Thank you for having me.
We are counting down to our #1 newsmaker of the day.